4 million elderly people in the United States alone have died from something that started right after dinner. And what terrifies me as a physician is that most of them had no idea they were in danger. Their families had no idea. And the habit that killed them is something that nearly every person over 60 does almost every single night without thinking twice about it. I am Dr. Michael Hayes, board-certified gastroenterologist with 18 years of clinical experience, and I need you to watch this entire video because what I am about to show you could save your life or the life of someone you love. And I am not exaggerating when I say that the next 7 minutes might be the most important medical information you hear this year. Before we go any further, this is educational content and not personal medical advice. Always consult your healthcare provider before making any changes to your health routine. But please, I am begging you, do not scroll past this video until you understand what I am about to explain. The habit I am talking about seems completely harmless. It seems comfortable. It seems like the natural thing to do after a long day, and that is exactly why it has claimed so many lives. Because danger that looks harmless is the most deadly kind of danger there is. Let me tell you about Margaret, 74 years old, retired school teacher from Ohio, healthy by every standard measurement, walked 2 miles every morning, took her blood pressure medication faithfully, had dinner with her husband every evening at 6:30, watched television until 8, and then did exactly what she had done for 43 years of marriage. She went to lie down on the couch because her back hurt, and she wanted to rest while her food digested. 12 days later, Margaret was in the intensive care unit with a tube down her throat, fighting for her life against pneumonia that seemed to come from nowhere. And when I reviewed her case, when I traced back every decision, every habit, every seemingly innocent choice, I found the moment that started the cascade. And it was that couch, it was that position, it was that timing. It was the 75 minutes between finishing her pot roast and lying flat on her back while her stomach was still full of undigested food. If you or someone you love is over 60 and you eat dinner and then lie down within 2 to 3 hours, I need you to understand that you are playing Russian roulette with your life. And the bullet in that chamber is something called silent aspiration, and it kills more elderly people than most cancers, more than car accidents, more than falls, and almost nobody is talking about it because it does not happen dramatically. It happens silently, night after night, meal after meal, until suddenly it does not matter anymore because the damage is done. Subscribe right now because next week I am releasing a complete guide on the 5 nighttime routines that protect your lungs, and you cannot afford to miss that information. Now let me explain exactly what is happening inside your body when you lie down after eating, because once you understand this, you will never make this mistake again. Your stomach is essentially a muscular bag that sits in the upper left portion of your abdomen, and when you eat dinner, that bag fills with food, liquid, and powerful digestive acids that have a pH level similar to battery acid, designed to break down everything you consume. At the top of your stomach, where it connects to your esophagus, there is a ring of muscle called the lower esophageal sphincter, and its job is to act as a one-way valve, letting food go down but preventing anything from coming back up. Here is what most people do not realize. That valve is not a perfect seal, especially as you get older, because the muscles weaken, the tissue becomes less elastic, and the valve that protected you at 30 is significantly compromised by 65. When you are sitting upright or standing, gravity helps that valve do its job. The weight of the food and liquid stays down in the stomach where it belongs. The acid stays contained, and your esophagus and airways remain protected. But the moment you lie down, everything changes. Gravity is no longer your ally, it becomes your enemy. And here is where the danger begins that almost nobody talks about. When you lie flat after eating, the contents of your stomach, the food, the liquid, the digestive acids, all of that material now has direct access to that weakened valve. And in many people over 60, small amounts of that material escape upward into the esophagus. Now, for younger people, this might cause heartburn, discomfort, maybe a bad night of sleep. But for elderly people, something far more dangerous can happen, something called aspiration. Aspiration occurs when material from your stomach enters your airway instead of staying in your digestive tract. And here is the terrifying part. In elderly people, this can happen without any symptoms whatsoever. No coughing, no choking, no burning sensation, nothing that alerts you to the danger. This is called silent aspiration, and studies show that between 20 and 40% of elderly people experience it regularly without ever knowing. Let me explain why this is so deadly. When stomach contents enter your lungs, even in tiny amounts, they bring bacteria with them. Bacteria that your lungs were never designed to handle. Bacteria that thrive in the warm, moist environment of lung tissue. And when those bacteria take hold, they cause an infection called aspiration pneumonia. Aspiration pneumonia is not like regular pneumonia that you might catch from a virus or from someone coughing near you. Aspiration pneumonia is caused by your own body, by your own stomach contents, and it is one of the leading causes of death in people over 65. The statistics are staggering. Aspiration pneumonia accounts for between 5 and 15% of all community-acquired pneumonia cases, but in nursing home residents and hospitalized elderly patients, that number jumps to nearly 70%. In patients who develop aspiration pneumonia, the mortality rate can reach 30 to 50%, meaning that 1 out of every 2 to 3 elderly people who develop this condition will not survive it. And it all starts with that moment after dinner when you lie down too soon, when gravity stops protecting you, when that weakened valve fails to hold back the contents of your stomach, and when material silently enters your airways while you rest, completely unaware that damage is occurring. Comment below and tell me, what time do you usually eat dinner and how soon after do you lie down? I need to know how widespread this danger is in my community. Let me tell you about another patient because I want you to understand that this is not rare. This is not something that only happens to sick people. This happens to healthy, active seniors every single day. Harold, 68 years old, former construction supervisor from Texas, strong as an ox, never smoked a day in his life, ate dinner every night around 7, and had a habit of falling asleep in his recliner by 8 while watching football. His wife thought it was harmless. He thought it was harmless. And for 5 years, nothing seemed wrong. But what was happening inside Harold's body during those 5 years was a slow accumulation of damage. Every time he dozed off in that recliner after dinner, small amounts of gastric content were entering his airways. Not enough to make him cough, not enough to wake him up, but enough to cause microscopic inflammation in his lung tissue night after night after night. Then one October evening, Harold developed what seemed like a mild cold, a little cough, some fatigue, nothing that worried him enough to see a doctor. 3 days later, he could not breathe well enough to walk to the bathroom. 4 days later, he was in the emergency room. 5 days later, I was standing at his bedside in the ICU explaining to his wife that the pneumonia had spread to both lungs and that the next 48 hours would determine whether he lived or died. Harold survived, but just barely. And he spent 6 weeks recovering, lost 23 pounds of muscle mass, and never returned to the same level of function he had before. When I asked him about his habits, when I traced back the timeline, it all started with that recliner. It all started with those post-dinner naps that seemed so innocent, so comfortable, so routine. I need you to understand something critical. The danger is not just lying completely flat. The danger is any position that allows your stomach contents to move upward while you still have undigested food in your system. A recliner that only elevates your upper body 10 or 15 degrees is not enough. A pillow or two under your head is not enough. Your body needs time to empty the stomach before you assume any reclined position. And for most elderly people, that means a minimum of 3 to 4 hours between the last bite of food and any horizontal or semi-horizontal position. Now I want to explain the anatomy in more detail because understanding this will save your life. Your esophagus is approximately 10 inches long, and it runs from your throat down through your chest, passing right behind your heart, and then through an opening in your diaphragm called the hiatus before connecting to your stomach. That lower esophageal sphincter I mentioned earlier sits right at that junction, and in young, healthy people, it maintains a pressure of about 15 to 30 millimeters of mercury, keeping the stomach contents sealed below. But as you age, several things happen. The muscle fibers of the sphincter become less coordinated, the tissue loses elasticity, the angle at which the esophagus enters the stomach becomes less acute, and the overall pressure the valve can generate decreases significantly. By age 70, many people have a sphincter that generates less than 10 millimeters of mercury of pressure, which is barely enough to prevent reflux even in ideal conditions. Add to this the fact that many elderly people take medications that further relax this sphincter, medications for blood pressure, medications for anxiety, medications for chronic pain, and the protective barrier becomes even weaker. Now add one more factor. The rate at which your stomach empties food slows dramatically as you age. A meal that might empty from the stomach in 90 minutes at age 30 can take 3 to 4 hours or longer at age 70. This means that when an elderly person lies down 2 hours after dinner, their stomach is still significantly full, still producing acid, still containing material that can be aspirated. The combination of a weakened valve, a full stomach, and the loss of gravitational protection creates the perfect conditions for aspiration. If this is making sense and you want to protect yourself and your loved ones, subscribe now and turn on notifications because I release new content every week that could save your life. Now let me tell you exactly what happens when gastric contents enter the lungs, because the mechanism of damage is something every person over 60 needs to understand. When material from your stomach enters your airways, 3 types of injury occur simultaneously. First, there is chemical injury from the acid itself. Gastric acid has a pH of 1.5 to 3.5, which is corrosive enough to cause immediate damage to the delicate tissues lining your respiratory tract. This chemical burn occurs within seconds of aspiration and begins a cascade of inflammation that can spread rapidly through the lung tissue. Second, there is bacterial contamination. Your mouth and stomach contain millions of bacteria that are perfectly safe in the digestive tract, but become deadly pathogens when introduced to the lungs. Within hours of aspiration, these bacteria begin multiplying in the warm, nutrient-rich environment of damaged lung tissue, and an infection begins to take hold. Third, there is particulate obstruction. Food particles, even microscopic ones, can block the tiny airways in your lungs called bronchioles, preventing oxygen from reaching the blood and creating pockets of collapsed lung tissue where bacteria thrive even more effectively. The combination of these 3 injury mechanisms is what makes aspiration pneumonia so deadly, because you are not fighting a single type of damage. You are fighting chemical burns, bacterial infection, and mechanical obstruction all at the same time, and your elderly immune system, already weakened by age and often compromised by chronic conditions, struggles to contain the assault. Now here is what I need you to understand about timing, because timing is everything when it comes to this danger. The window of maximum risk begins the moment you lie down after eating and continues until your stomach has emptied sufficiently, which for most elderly people means 3 to 4 hours after a normal-sized meal and longer after a large meal or a meal high in fat. During this window, any position that is not fully upright creates an opportunity for aspiration. A 30-degree recline in a chair is not safe enough. A couple of pillows under your head while lying in bed is not safe enough. Your torso needs to remain at least 45 degrees elevated, and ideally completely upright, until adequate time has passed for gastric emptying. Let me give you a visual that might help. Imagine your stomach as a cup of liquid sitting on a table. When the cup is upright, the liquid stays contained. Tilt the cup even slightly, and liquid begins to spill toward the lowest edge. Now imagine that cup has a lid that does not seal properly, the kind of lid you might find on a coffee cup that has been reused too many times. Even with the lid on, tilting that cup will cause liquid to leak out the edges. This is exactly what happens with an aging lower esophageal sphincter when you recline after eating. The lid is there, but it does not seal anymore, and any tilt allows contents to escape. Now I want to address something that many people do not realize. The symptoms of silent aspiration and early aspiration pneumonia are often mistaken for other conditions, which is why so many cases progress to life-threatening severity before anyone realizes what is happening. Early signs can include subtle changes in voice quality, a slightly wet or gurgly sound to the voice, especially in the morning, occasional throat clearing that does not seem productive, a mild cough that comes and goes without obvious cause, slight difficulty swallowing that might be attributed to aging, episodes of unexplained shortness of breath, and general fatigue that seems out of proportion to activity level. Many people dismiss these symptoms or attribute them to allergies, a cold that is taking too long to resolve, the natural aging process, or just not sleeping well. By the time fever develops, by the time the cough becomes persistent, by the time breathing becomes noticeably difficult, the pneumonia has often progressed to a dangerous stage that requires hospitalization. I want to be very clear about something. If you or someone you love is experiencing severe shortness of breath, high fever, confusion, chest pain, coughing up blood or material that looks like coffee grounds, or any rapid change in mental status, call 911 immediately. These are signs of serious illness that requires emergency medical attention. And I am not trying to create panic. I am trying to save lives by making sure you know when to act. Now let me give you the exact protocol that can protect you from this danger, because understanding the problem is only valuable if you also understand the solution. Step 1 is the most critical. Establish a minimum time gap between your last bite of food and any reclined position. For most people over 60, this means a minimum of 3 hours and ideally 4 hours between dinner and lying down. If you typically eat dinner at 6 in the evening and go to bed at 10, you are giving your body 4 hours of upright time, which is excellent. If you eat dinner at 7 and go to bed at 9, you are only giving your body 2 hours, which is in the danger zone. Adjust your dinner time earlier or your bedtime later to ensure adequate gastric emptying before you assume any position that is not upright. You are not helpless against these dangers. You are not destined to become a statistic. You have the ability right now, today, to make changes that could add years to your life and life to your years. I need to emphasize the symptoms that require immediate medical attention one more time, because this information could save your life. If you experience sudden, severe shortness of breath, this is an emergency. If you experience chest pain that feels crushing or radiating to your arm, neck, or jaw, this could be a heart attack and you need to call 911 immediately. If you experience confusion or altered mental status, this is an emergency. If you develop a fever over 100.4 degrees Fahrenheit along with cough and difficulty breathing, you need medical evaluation that day. If you cough up blood or material that looks like coffee grounds, go to the emergency room immediately. If you have difficulty swallowing that comes on suddenly or is accompanied by pain, seek medical care promptly. If you notice unexplained weight loss of more than 10 pounds, this requires investigation. These symptoms may or may not be related to aspiration, but they all require professional evaluation, and I would rather you seek care and find out it was nothing serious than ignore warning signs and wait until the situation becomes critical. Now, let me address a question I know many of you are thinking. What about medications? Many elderly people take proton pump inhibitors or other acid-reducing medications, and they wonder if this protects them from aspiration risk. Here is the truth. Acid-reducing medications can help reduce the chemical injury component of aspiration by making the refluxed material less acidic, but they do not prevent aspiration itself. The bacteria are still there. The particulate matter is still there. The mechanical obstruction still occurs. Medication can be part of a comprehensive approach, but it is not a substitute for proper timing and positioning. Some of my patients need both medication and lifestyle modification. Others can reduce or eliminate medication over time by optimizing their habits. This is something to discuss with your doctor based on your individual situation. But please do not assume that because you take an antacid, you are protected from aspiration pneumonia. You are not. The physical positioning and timing rules still apply. Let me talk about why this information is not more widely known, because I believe this is important to understand. Aspiration pneumonia is what we call a multifactorial condition, meaning it has multiple contributing causes, and this makes it harder to point to a single habit and say this is the problem. Additionally, because silent aspiration happens without symptoms, because the damage accumulates gradually, and because the pneumonia that eventually develops looks similar to other types of pneumonia, the connection between post-dinner habits and lung infection is often missed. Many doctors treat the pneumonia without ever investigating the underlying cause. The patient recovers, goes back to their habits, and the cycle begins again. I have seen patients who had 4, 5, 6 episodes of pneumonia before anyone thought to ask about their evening routine. This is a failure of our medical system to think about prevention and root causes, and it is why I am making this video, because you deserve to understand the connection that your doctor might not have time to explain. Share this video right now with someone over 60 who eats dinner and lies down shortly after. You could be saving their life. And I mean that literally. The 4 million deaths I mentioned at the beginning of this video did not need to happen. They happened because of a lack of information, because of habits that seemed harmless, because the danger was invisible and silent and no one explained the mechanism in time. You now have that information, you understand the mechanism, you know what to do differently. Now I want to talk about how to help elderly family members implement these changes, because I know many of you are watching this for your parents, your grandparents, your spouse, and changing lifelong habits is not easy, especially when the danger is invisible. The first step is to share this video with them. Let them hear the explanation from a physician. Let them understand why the change matters. Do not lecture them or make them feel criticized for habits they have had for decades. Approach it from a place of love and concern. Second, help them problem solve the practical obstacles. If they eat dinner late because of medication timing or social routines, help them adjust their schedule. If they fall asleep in the recliner out of habit, suggest alternatives like an upright chair or a gentle walk after dinner. If they live alone and have no one to remind them, help them set phone alarms or create visual reminders. Third, make it a household change rather than singling them out. If you eat dinner together, move the meal earlier together. If you watch television in the evening, sit in upright chairs together. Making it a shared adjustment reduces the feeling of being told what to do and increases compliance. Fourth, celebrate improvements. When they tell you they slept better, when the morning throat clearing decreases, when they feel more energetic, acknowledge the connection to the changes they made. Positive reinforcement is powerful, especially for habits that do not have immediate dramatic results. Now let me give you the final piece of this puzzle, which is understanding your individual risk level. Because while everyone over 60 should be aware of this danger, some people are at higher risk than others. You are at elevated risk if you have a history of gastroesophageal reflux disease or GERD. You are at elevated risk if you have had a stroke or any neurological condition that affects swallowing. You are at elevated risk if you have diabetes, because diabetes slows gastric emptying. You are at elevated risk if you take medications that relax the lower esophageal sphincter, including many blood pressure medications, benzodiazepines, and some pain medications. You are at elevated risk if you have a hiatal hernia, where part of the stomach pushes up through the diaphragm. You are at elevated risk if you have difficulty swallowing or have been told you have dysphagia. You are at elevated risk if you have chronic lung disease or a weakened immune system. You are at elevated risk if you have had pneumonia before, especially if it was aspiration pneumonia or occurred more than once. If any of these factors apply to you, the habits I described are not just good ideas, they are essential for your survival, and you should discuss aspiration risk specifically with your healthcare provider at your next visit. Here is what I want you to do right now, before you close this video, before you move on with your day. I want you to commit to one specific change. Either you commit to moving dinner earlier so you have a full 3 to 4 hours before lying down, or you commit to staying fully upright for at least 90 minutes after dinner before sitting in any reclined position, or you commit to elevating the head of your bed and sleeping on your left side. or you commit to sharing this video with an elderly person you love. Pick one change, make it specific, and comment below telling me exactly what you are going to do differently starting tonight. Like this video if it opened your eyes to a danger you did not understand before. Subscribe if you want weekly content that could save your life or the lives of people you care about. Share this with everyone over 60 that you know, because this information is not reaching people fast enough and the statistics are devastating. Turn on notifications so you never miss a video. And comment your commitment below, because public commitment dramatically increases follow-through. Every action you take right now, every like, every subscription, every share, every comment, helps this information reach more people who need it. 4 million deaths could have been prevented. Let that number sink in. 4 million elderly people who ate dinner, lay down too soon, aspirated stomach contents silently night after night, developed pneumonia, and lost their lives. They did not know. Their families did not know. Their doctors often did not even make the connection until it was too late. You know now. What you do with this knowledge is your choice, but I hope you choose to act, because prevention is always better than treatment, and the people you love deserve the chance to hear this before it is too late for them. I'm Dr. Michael Hayes. Thank you for watching this entire video. Please share it immediately with anyone who needs to hear it, and I will see you in the next video where I will show you the 5 nighttime routines that protect your lungs, your heart, and your life.